I've enjoyed most about the Summit event is that all the quality of the speakers and the messages are just always on point and really relevant. That's really what I glean most.
I think the quality of the sessions has been very, very high. In particular, I think what's unique about the conference is that the sessions are very forward-thinking, looking at new innovations and on topics that are very relevant in the context of the changing healthcare environment.
I think it's hearing what is going on around the country, hearing from folks who are sort of getting into things first and finding out how they're seeing new developments, new trends, and also getting introductory material at the same time as intensive expert material, so it's a nice balance.
The thing that I've enjoyed most about this Summit event is really the breadth of information of things not only that have happened that are transformative to the industry, but more so what is on the horizon for the changes.
Obviously learning from a lot of national experts on topics like bundled payment and things that really our area has just probably started to really talk about. So it's nice to look ahead to see what maybe we have a better chance of preparing for than others maybe that have not had that luxury.
Oh, there's all kinds of things I've learned that we'll be taking back. In fact, all our board members are here, which is fairly rare. But we've already started talking about some of the things. But new concepts like a sniffist, which I'd never even heard of before, the social determinants, which seems to be sort of a major trend this year in the discussions. So a lot of those things we'll be bringing back and seeing how we can work with HDG to implement them into our facilities operations.
I take that information back to my customers, and it's very important that I share with not only what's happening right now, but what the future has for us, because it's important in terms of providing them the value that they need from myself as a vendor, and then ultimately, identifying certain solutions that can help them in their business with all the changes that are happening.
I have lots of notes. I think, again, care coordination and kind of that integration across all of those continuums of care, but really taking that back and say, we need to move a little faster pace for that, and how do we structure our organization to be able to do that more effectively. So that's probably my immediate take back, is how do we really speed up that care coordination and integration. Networking with people who are in lots of different situations is always helpful too, and I've enjoyed that a lot.